I'm Dr. Beverly Robinson. I was faculty member at the School of Nursing from 1979 to 2011. I'm currently Professor Emeritus. Prior to that designation, I was the Associate Dean for the Graduate Nursing Program, Lilly Kranz Cullen Endowed Professor, and Director of Doctoral Studies. School of Nursing has always had an impact, ever since its inception, on the community, from the patient level, the family level, and the general community. We very specifically focused on underserved and unserved areas, minority areas, and our students really contributed an enormous amount to the community of San Antonio with health fairs, their clinical experiences, and that sort of thing. In terms of nursing, we provided the opportunity for community nurses in a number of levels to advance their education. And LVNs in one of our programs were able to obtain their BSN degrees. We had ADN to BSN options for degrees, and of course our graduate nursing program expanded advanced nurses in all of Texas, most specifically in South Texas and where we are now in Central Texas, South Central Texas. We are part of the healthcare professionals, and nurses are the frontline caregivers. And so the better educated our nursing community are, the better patient care we can provide. Nurses in academia are expected to become, as part of their role, researchers. They're teachers, they're practice people, and they're researchers. And consequently, our research informs practice. So we research patient-focused activities. Either we study long-held practices to see if they really, hold up. We take a look at specific patient groups and how to improve care to those groups, specific patient diseases that may be of interest to the particular researcher, and how we can improve care in that area. So research informs practice. That was one of the exciting aspects of my career, one of them. And it really speaks to the fact that as an academic, your focus not only is in practice and research, but for me, it was teaching. We were preparing the nurses for the future, and as went our teaching and what we imparted to our students as went the practice and care of our patients. So it was most important to be an excellent teacher. School of Nursing has always had a reputation for being an excellent provider of education for nurses at every level, and certainly at the baccalaureate and master's level. At the master's level, our students, our graduates, have really expanded education in Texas and internationally. We had a series of programs that related to the military. Military would send their students to our various majors as clinical nurse specialists, as nurse practitioners, certainly as nurse anesthetists, and occasionally as administrators. And those particular graduates of our program, who were always outstanding students, were deployed all over the world. So nursing education expanded all over the world. Technology guided both the master's and the doctoral programs. In fact, all aspects of teaching at the nursing school. In terms of the master's program, technology was probably one of the most decisive things in the evolution of education at the nursing school. And faculty were eager to learn the new technologies for expanding our ability to reach so many students. We were one of the first schools of nursing to use distance education. We initially, when we took our community health nursing and our med-surg nursing programs to South Texas, because that was such an unserved and underserved area, and we had nurses there who were eager for advanced education. Initially, we flew there and taught. We gradually moved during the time that I taught in South Texas. I taught research there. We moved to distance education, and we would track things from San Antonio to South Texas, and we had the privilege of working at UT Brownsville on that campus, and they were very welcoming to us because of the need for graduate education and baccalaureate education in South Texas. And so they allowed us to put our equipment there and beam some of our educational programs there. Yet faculty continued to be on site, and for just the one-on-one contact that's so important in nursing education, and just to get to know the community. For example, I taught on Friday nights and all day Saturday, once a month down there, a research course. So what I would do is I'd fly in on Friday morning, pick up my rental car, and go up and down the valley. Each time I went to a different student's work setting to get to know their setting, them a little bit better, and get to know South Texas. And that was a tremendously valuable experience to me, especially when we started to distance our doctoral program in South Texas. I had connections that I'd had for years. Well, one of the things the nursing school has always been known for is their willingness to try new things. And technology directed practice and delivery and was a master influencer of that. Over the course of the years, I saw, as I said, us flying to the location for teaching, ultimately distance education. We started to use computers. We did skills testing and simulation we even changed the way we approached testing from pencil and paper to ultimately computer testing, which proved more effective and so many students liked. The Associate Dean for Graduate Nursing in 1998, we had a variety of master's level majors, both in the areas of clinical nurse specialist, nurse practitioner, nurse anesthetist, and administration, and which was a clinical nurse specialist option for us. We gradually evolved into what ultimately became the Doctor of Nursing practice over the years and beyond the 2011 period. But during that course of time, the master's program was under the direction, under the auspices of the umbrella of the Graduate School of Biomedical Sciences. And they awarded our master's degrees and also ultimately our PhD once we got our PhD program. But the goal of the Committee on Graduate Studies, who oversaw graduate education and curriculum in the nursing school, was that our graduates would be awarded their degrees from the nursing school. That idea got planted, and we worked with the Graduate School of Biomedical Sciences and the administrators there, and we moved to the coordinating board through the president's office, and ultimately we were able to have total control of our nursing master's program under the umbrella of the School of Nursing. Of course, the doctoral or the PhD program stayed in that arena because all PhD programs were theirs also. The PhD program in nursing was a vision that started in 1989 in a discussion among graduate faculty on the Committee of Graduate Studies. We had a vision that we wanted to be unique. We wanted a practice doctorate. There was currently a research doctorate being offered in the state, but we wanted a practice doctorate, and we wanted it to be patient-focused and patient-centered, and all research be patient-focused and patient-centered. It was also unique in that we partnered with Texas Tech University School of Nursing to offer a PhD in the more rural areas of Texas. We ultimately expanded it to Texas A&M University Corpus Christi. They were courteous enough to give us a room at that facility so that nurses in South Texas and along the Rio Grande Valley could come to that location. We implemented distance education, and they were able also to earn PhDs in nursing. What also made this a unique program and a unique doctoral program was the fact that we partnered with Texas Tech, a School of Nursing, and we had 2 faculty assigned to each course, one from Texas Tech and one from the School of Nursing here in San Antonio. And that was certainly nationwide a different kind of approach. And I spoke about it all over the country at various nursing, particularly advanced education conferences. The doctorate of nursing practice was an idea put forth by Dean Breslin when she arrived. And we were steeped in the PhD program and our approach to research related to practice. The doctorate of nursing practice was an opportunity for nurses to have specialties and earn a practice doctorate. That particular doctorate would not be under the auspices of the Graduate School of Biomedical Sciences. However, it's a nursing doctorate degree and more of a practice doctorate. But it really expanded the ability of nurses to learn more in depth about what it took to change practice, to change patient-centered approaches to care. And it really enhanced the ability of nurses to practice at a greater depth. That particular program went forth through the system to the coordinating board about 2011, about the time I retired. The Lilliecrans Cullen Endowed Professorship was a particular chair, a position that had a designation that went along with the title of being the Associate Dean for the Graduate Nursing Program. And as such, the people who established this particular chair wanted the graduate dean to have access to funds that allowed for flexibility in how they were used. I used those funds for developing myself as a dean and professor, with attending conferences around the country. I used it to pay for doctoral students to attend conferences around the country. And we also spent quite a bit of that funding in bringing in experts from around the country to meet with our students, master's and doctoral students, and our faculty. And that proved to be one of the more successful aspects of the use of those funds. Nursing research is unique. As I've said before, it's very much patient-focused, patient-driven. It's our intent to change the practice, the lifestyles, the living conditions of patients. And our research drove or allowed for changes in practice and our approach to caring for patients, be they individuals, be they families, or communities. We're frontline givers of care at every level. I've already said that the more educated a nurse is, the better care they can provide for their patient. We've done some activities for years and years because that's the way it was done. Nursing research allows for us to take those theories, if you will, or ideas, and test them, compare them, and see which one really is most effective for patient care. And this drives practice. As one of the first African American graduates of the University of Texas at Austin in 1968, I wanted to become what I never had. I never had a mentor. I never had a faculty support person or many faculty who really cared if I succeeded. And that, in part, was why I did succeed. I took my education at the School of Nursing at UT in the 60s as I'll show you approach. When I became a public health nurse, one of the things that I got was very specific mentoring into the role of a public health nurse by some very caring nurses. So I learned the value of what it meant to have mentors, to have support people, to have encouragers in your profession. So when the opportunity it presented itself as a faculty to become a mentor for other students, I was right there. That was one of the first things that I wanted to do. When I came to the nursing school in 1979, I came from practice. So I had learned what it meant to have a mentor and how valuable they can be to you. For me, in learning the practice of being a public health nurse. And when I came to the nursing school, I had over the course of my career, four major people that really influenced my career. The first was Dean Patti Hawken, who hired me in 1979. On an annual basis, all faculty met with Dean Hawken in her chats with Pat. They were the dreaded chats because she challenged you in three areas: your teaching, your practice, and your research. And you had to have goals. And she remembered them better than you. So the following chat, you had to show your progress. So that was a challenge, and it really kept you scrambling because you did not want to disappoint. So she was a tremendous influence on my career in having me shift my thinking into thinking as an academic and making a career of teaching. The second person who influenced my career was Miss Ruth Stewart. She was one of the first faculty at the School of Nursing. She was a public health nurse. She took me, a young, mouthy public health nurse, under her wing as a first-year teacher. And she guided me toward career things. Often I was kicking and screaming and didn't want to do it. But she casually offered suggestions that she really seriously meant for me to follow through with. And it took me a while to realize that. But ultimately, it led me to national seats, if you will. I was involved in the early American Nurses Credentialing Center in a generalist testing, in test taking, selection of the items for national testing, that ultimately led me to being chair of the American Nurses Credentialing Center. That led me to having a seat on the American Nurses Association Board of Directors, all influenced because Ruth Stewart said to me, "You need to do this." She was also a co-sponsor of my admission to fellowship in the American Academy of Nursing. She encouraged me to put forth my name to become a member of the Texas Board of Health under George Bush. I was one of 64 candidates for two seats, that particular placement on the Texas Board of Health. And I ultimately was appointed and served 4 years on that Board of Health. And that was an enormously important experience in getting a look-see at healthcare all over Texas and the various considerations that a board had to make related to the health and welfare of the people of Texas. And that was an enormously informative experience. A tremendous amount of work, unbelievable amount of work, but just a wonderful experience. The third person that was a major factor in my career and in my life, and still is my dear friend Dr. Beth Stewart. We met on my first day in 1979 as a nursing school faculty. She approached me with a big smile and welcomed me. She later suggested that we form the Mary Mahoney Nursing Student Association. We became research partners. We were cheerleaders. We got our doctorates at the same time. And we ultimately just supported each other in what was often a very difficult environment. The fourth person was my husband, Ron. As I became busier in my career, I had a reluctance. We had a young child, and he says, I can handle this. He took increased responsibility for the management of our son, our household. He encouraged me as I advanced in leadership. I had more to do at home in terms of work, study, preparation, and he encouraged and supported that, and I could not have done it without his help. I was a young radical, okay? I was always a very self assured, outspoken student. When I attended the University of Texas, I graduated Austin High School, Stephen F. Austin High School in Austin, Texas, in the end of May. June 1st, I started as a student at the University of Texas in Austin. And I moved into the nursing program that fall when I started to meet advisors and that sort of thing. And it was not a welcoming environment. I was one of two African American students. And interestingly enough, the other one happened to be my roommate, my college roommate. And so we partnered with one another in working our way through the preliminary courses. At the time, there was only one nursing school in Texas. We spent 2 years on the main Austin campus. We transferred down to the University of Texas Medical Branch in Galveston. And we spent a year and a half. We went back to Austin to complete our community health nursing rotation there in Austin, and we were awarded our degrees at UT Austin. The Galveston experience was fairly traumatic. We were not welcomed, per se, even among our classmates who would, prior to an exam, be in the lobby studying all night, and they would never once knock on our door and say, come join us for group study, and that sort of thing. We were put at the last rooms at the dormitory behind the fire door. And it was not just, we had difficulty finding places that we could go eat to avoid the hospital cafeteria. Now, you have to remember this was the end of the 1960s, and things weren't great in Texas. Some places, yes, but most places, not for African Americans. So, but we were determined that we were going to finish that school. I graduated from the school an angry person. I got better as I went into practice and that sort of thing, kind of relinquished my attitude somewhat. But I never forgot those experiences. And when it came time for me to get a PhD, and the dean was pressuring, Dean Hawken was pressuring, said, if you're going to stay in academia, you need to get your doctorate if you're going to move forward. Well, my dear friend Beth Stewart says, Bev, you are going to go to one of the best PhD programs in the country, and you're going to forget that anger, you're going to put it on the back burner, and you're going down to UT Austin, and you're going to get you another degree from there. And I said some things that I won't repeat now. Ultimately, she drugged me, kicking and screaming, down to Austin, where I ultimately got my PhD. And I can thank my dear friend for that, because I had no intentions of ever setting foot on that campus again. I did not realize I had the residual anger until I was contacted last year about coming to the 50th anniversary reunion, which was several weeks ago in October. I chose not to go. I wouldn't submit a bio. I wouldn't do anything, despite their constant contact of me. And what comes in my mail last week was a hot cold cup that they sent me with the engraving on it from the 50th anniversary commemorative um, celebration. So I had to laugh and smile and realize that I had mellowed in my old age to a degree, to a degree. But and that was one of the things that led me to Mary Mahoney, that led me to mentoring. I didn't want other people to have those kinds of experiences in my school of nursing. Mary Mahoney was the first African American registered nurse in the United States, and she set forth a lot of. She encountered a lot of challenges. She overcame a lot of challenges, and she was just a tremendous model for our students. That if she could do this in the 1800s, you can do it now. Mary Mahoney was the blueprint for ultimately the other minority associations that came. Approximately 9 years after the establishment of Mary Mahoney Nursing Student Association, the Hispanic Nurses Student Association was established, and later the Asian Nursing Student Association. So it was the start of it all. In the fall of 1979, Dr. Beth Stewart approached me with the idea that we needed to take an interest in the African American students in our school, very few, but we needed to assure that they maneuvered through the school, felt welcomed, and were able to be successful in achieving their baccalaureate degrees in nursing. I welcomed the idea, and we wanted to do what we hadn't experienced, and that was have warm mentors and people who had open door policies and who they could come and discuss their deepest distresses. Not necessarily that we could solve the problem for them, but we could be encouragers of them and encouragers of success, and even go so far as to explain to their families what they were experiencing, because quite often the families did not understand. I happen to be third generation college, but many of these students were first generation college, and their parents and their supporters who loved and cared about them just couldn't understand quite what they were going through. And nursing education is different from many college educations because we have students that had to understand. They did preparation for class, lecture, content, that sort of thing. They did preparation for clinical, and they did preparation for skills lab. So let's say 3-hour course, or in that time we had block courses that were 12-hour courses. That was an enormous amount of content, an enormous amount of studying, and parents could not understand. They had previously watched this particular student taking courses at wherever they happened to go for their preparation for the junior and senior year of nursing, do 3-hour courses without spending nearly the time. So they had to understand what it took to do nursing and earn that baccalaureate. So we would often informally meet with the parents. We would have informal gatherings so that parents could hear the side of what the student was experiencing from other parents. And we also work with them on tutoring and how even to talk to faculty and have that exchange and encourage one another in being successful. So ultimately, that led to the university recognized formation of the Mary Mahoney Nursing Student Association. and that became it was an official recognized School of Nursing organization until we disbanded in 2011. Under the auspices of Mary Mahoney Nursing Student Association, what we did tutoring, we did encouraging, but also the students had a number of activities. One of the things we did annually was have African American History Week, and we would have some sort of program, some sort of speaker, something would happen. Art exhibits, we did all sorts of things over the years in recognition of Black history and African American nurses who have succeeded on a national level from around the country. And we also had our annual chili cook-off that raised funds for scholarships. And the scholarships were contained within Mary Mahoney. So minority students were given scholarships based on their hard work within the organization. But we had to be careful to balance activities that we wanted to do in the community. We did a lot of screening, blood pressure, taking a look at patients' medications, dealing with the elderly. We looked at the medication, and at the time we didn't have sophisticated things like you put it in the computer and they told you what was in conflict with something else. So students had to work with them carefully to make sure that they weren't over-medicated and that sort of thing. And something that's unique to African Americans is often medications developed for pharmaceutical companies for the general public did not work well for them. So those things we had to be cognizant of and help students to understand. I was inducted into the American Academy of Nursing in 1993. I had two co-sponsors. One was my mentor, Ruth Stewart, and the other was a person that I sat on a National Research Review Grant Committee. She approached me and said, I think I would like to nominate you for sponsorship as a sponsor in the American Academy of Nursing. It came out of nowhere. I was floored. I was fairly young in my career at that time, but I was at a point where I was not certain that I would be successful if someone sponsored me for the Academy. It was a very small organization. They were well known for not admitting you on the first go-round. It was an organization where it was small enough that every member voted. And it had to do not with what you did in your regular job. They looked at what you did outside of your job. And in my case, it happened to be service primarily to the minority community. I sat on the boards of several local community centers on the east side of San Antonio, primarily the Ella Austin Community Center. I took my students there. I was well known in the community because of my students and their home visits to patients and my activities with Mary Mahoney Nursing Students Association in the minority East Side community. And so for me, it was service. I sat on the Healthcare for the Homeless Board, and I did much of my research and work with AIDS patients. So the unserved and underserved were of tremendous interest to me, and apparently to the Academy also. I was voted in on my first application, and it was just a thrill and really one of the highlights of my years as a nurse. When I came to the nursing school in 1979, we had moved here from Houston, where I'd been head of family planning services for Houston-Harris County, and I reluctantly came to San Antonio. Academics had never crossed my mind. I was master's prepared, but in searching for a job in San Antonio, I discovered community health or public health, as I knew it in Houston, Harris County, was running about 20 years ahead of San Antonio's public health community. So I was distressed by that. And I was talking to my former college roommate about it. And she suggested, why don't you give a thought to teaching? Teaching, I've never thought about teaching. So I picked up the telephone, and the first school that was listed happened to be, we had telephone books in those days, and it happened to be UT Health Science Center School of Nursing. And I called. I talked to Dean Patti Hawkins, administrative person. 2 hours later, she called me back, and we had a telephone conversation that lasted about 2.5 hours. And she arranged for interviews. And the two people that interviewed me were Ruth Stewart and Chloe McGill. And much to my amazement, I was hired for the fall. And the rest is history. Two things. One, they usually like to hire people with teaching experience, and I did not have the teaching credentials. I had practice and administrative credentials from my master's program. So I went back to school as I taught and got the teaching credentials. That guided my practice in that I always insisted that graduate students who even remotely thought they might want to teach would get the teaching credentials while they were in school. Much easier than trying to work and do it, particularly with the practice component. And when we had an informatics minor, I would often suggest that they do a dual minor and cover themselves on the technology side, because I saw that technology was rapidly unfolding. So you prepare yourself on the technology side so that you can build on that. But you want to be prepared to be an educator also. And the education doesn't necessarily have to be in the School of Nursing. A School of Nursing, it could be as a person in your hospital setting where you did the in-service education. You needed the same skill sets and the same kind of approaches and techniques that you use in education. And also informally, as you educated in communities, it really helped you with knowing your audience, knowing how to speak at their level, and for increased understanding. So if you're talking to a group of people with an average, let's say, 5th grade education, there are some approaches and words you don't want to use. I don't say dummy it down, but you want to talk at a level that the person clearly understands and can assimilate. And you don't want to over-inform, and you don't want to give them too much information. On the next time around, you just add a little bit more to it. I'll give you an example of what happened with one of my students when I was a beginning teacher. And I'd been a public health nurse for 8 years prior to coming here. And one of my students came back to post-clinical, and she was so frustrated with this lady. She had 5 children, but she had no education. She was almost illiterate. And her children, who were elementary age, were teaching her to read. And I had met the lady, and such a wonderful lady and so eager to learn. And so the student was saying how difficult it was to teach her about cooking methods and measuring. And she couldn't get her to understand about measurements. And so I said, okay, let's go back down. I went with the student to the house. We talked a while, and she was telling me about fractions. She had difficulty understanding fractions. I said, do you cook, don't you? She said, yes. I said, where are your measuring spoons and your measuring cups? And so we went in her kitchen, and I explained to her fractions using something that she understood. It's just practical things that you learn over the years as a public health nurse. One of my students, he had been an officer in Mary Mahoney as an undergraduate. He came back to the graduate program, and he worked at the VA, and I told him I was working out his program plan, and we did program plans on every student, and that was our contract with them, that the course would be offered when they needed it. And as I did the long-term projections, I knew when the courses were going to come up. So we carefully would set up the programs. This is most important program plans. This was most important for military people who had a very fixed 2-year window to get through school. But they went to school year round, and I knew that, so I was able to put in dual minors in their courses. But this particular male student, who was just a really great guy, and he worked at the VA, and he came back to graduate school. And I said, you're going to do a teaching minor and you're going to do an informatics minor. And he wasn't too enthusiastic about that. And I said, you're going to do it. And he said, yes, ma'am. So I set up the program plan. Well, a couple of years after he graduated, they decided to really use informatics in nursing. And he was the one person with the right credentials, and he got the job. And he called me and sheepishly laughing and talking, and I got great joy out of that. One of my many "I told you so" moments.